everybody. I'm Susan Collini, and welcome to our December Roundtable. We have some different people around today, so I'm going to start this off in saying a shout out, first of all, to Sarah.
Oh, yes.
So Sarah is out on maternity leave, yay! A new little grandson that we have, and so we're really excited about Luca. And shout out to them, and hope they're doing great today. So she'll be out for a little while. So we have some new staff amongst us. Firstly, Derek is MIA today because he's so busy he couldn't get out to join us today. And everybody wants their skin beautiful and great for the holidays. So that's where we are. But we're all strong and we can pitch it without him. So to my right, your left is Ronnie, and Ronnie's our medical assistant, our chief cook and bottle washer for IT, our scrub. I mean, he's doing a little bit everything there. And to my left and your right, which is Marley, Marley's our physician assistant, and you've met her many times, so she's going to add a lot of the medical information today, because I'll tell you what our topic is in a minute. And of course, to her left is Karen. Karen is our cosmetic nurse who's been with us for a very, very long time. We'll just say that. So she's quite seasoned and very experienced. And we have now to her left, again at your right, we're going around, you'll see a new face, and this is Lori. Lori Barone is our latest and newest laser esthetician. So she's going to be joining the ranks of the team, and we are really excited about that.
And happy. I'm excited to be here.
And I want to take this mention, so we're going to backtrack a little bit because we're doing a few little personal things here. We mentioned Sarah, first of all, but we also want to mention that Karen's going to be retiring with us. So this may or may not be her last roundtable. She has agreed to come back periodically as we need her, so we might be seeing her in the future, and I hope we do. But she's making some new life choices, and she's been with us over 20 years and has given us a lot of has given all of you wonderful services and a lot of information, and she's really a great part of the team. And she's my sister over here. We're born we have the same birthday. We do. So we celebrate that every year, yeah. I was going to say that. Because I have to compete with that. So today's topic is a little bit more medical but it's still cosmetic because this is something that concerns all of us. So today we're going to talk about scars and their treatments. And scars are always an issue for a lot of people, especially if they've been injured, number one, and secondly, if they've had surgery or any kind of procedure that leaves them with a mark on their skin. So to start this overview, I want to say, and I actually did a little bit of research, and there was one article in Google that said you can eliminate scars completely. And honestly, we've been doing this a very, very long time, and you cannot remove scars completely. So it is a myth to think just because you go to a plastic surgeon or the greatest person on earth that you will eliminate a scar completely. First of all, and I'll let Marley take this over in a minute, but when you first get an injury or you have, or if you've had a procedure, your skin has been cut, you've changed your skin forever. And that mechanism is about how we get good or bad scars. So I'm going to let Marley chime in a little bit here, and I'll kind of reiterate for some things that I want the team to say to all of you. And this conversation is talking about when you get them, how you get them, how long they last, how you can help them without doing anything interventionally, and then how are we going to treat them and how long can you treat them to get better results. So that's kind of the format for today. And then when we're finished, we'll just have a little reminder about all the wonderful cosmetic things you can do just before the holidays to look your very best. So we're going to have some fun things here. So I'm going to turn this over to Marley, and Marley's going to talk to us a little bit just about the medical, what happens when we cut the skin, Marley?
So whenever we cut the skin, whether it's a traumatic injury or a controlled surgical environment, you're going to go through the stages of wound healing. going to go through all of them, again, no matter how the skin is cut. So the first one being hemostasis, of course, the first thing, you're going to stop bleeding. Your body's going to coagulate, we're going to stop the bleeding. And then we go into the first couple days to the first week, that inflammatory phase, where all the white blood cells are rushing to the area and you get that swelling because where your body's trying to fight off any infection. And then in the first week to the first month, we have the proliferation phase, which is when all of that skin is reforming, all that scaffolding is rebuilding up. And then after that, after the first month to up to 2 years is the remodeling phase, and that's like the scar maturation phase that we're going through, which can take up to 2 years, where your body is still trying to remodel, trying to heal, the scar is softening. So those are the phases of wound healing, which I think are important to just kind of lay out, that no matter how your skin is cut, that's what we're going to go through. Because as you said, we're always going to have a scar, but it's how you treat it and all the things we can do to have you heal the best you can and have the least visible scar.
This is true. So at that point, I'm just going to interject here that there are 4 types of scars.
Yes.
And so
yeah.
I'll let you get into this. So I'm just throwing that in there. I'm just trying to keep us on so we're kind of in a format here.
Yeah. So we a normotrophic scar, which is just a flat, standard scar. So I guess that would be, the easiest one that we can fix. That would be if you have something, especially a lot of people don't like if they have a scar on their face, even though if it's not raised or anything, but it's just a straight line on your face. We can, I don't know, do you want to, should I go through all the scars
Just go through all the
and
scars.
then we can talk about the list? Okay.
Because we can be all over the place. This is a really multifaceted topic.
And then we have atrophic scars. So that would be a scar that is depressed, most often like acne scars. People call them pock marks, like when you have indentations, like in your chickenpox scars. And then we have hypertrophic scars, which is when the scar becomes raised and widened, often in an area of but that's moving a lot, like on the knee, or an area that's under a lot of tension. And then the last one being a keloid, and that is when your body really has an over response to the injury. And a fun fact, the word keloid comes from a Greek word meaning crab claw, because like what delineates one of the things from a hypertrophic scar versus a keloid, because I said a hypertrophic scar is raised, it can be wide, and but it stays in the confines of the wound. So if I have a cut, the scar, it could be widened and raised, but it's just staying where that tissue was damaged. But a keloid, though, I can have a little cut, and then your body just kind of really overreacts, and it crawls out of the confines of the skin that was damaged. So that's when you get those really big, a lot of times people get them on their shoulders. That's one of the most common places. Upper back, neck, ears, a lot of times from ear piercings. When you get those really big nodular
and they're expanding beyond what
they
you
can
think they
continue
would
to
do.
grow,
Right.
and they can be very painful.
And honestly, I do know that, just not being educated, knowing that, I know that sometimes when patients have,
Dr. Clay's calling me.
oh, is
So I'm just going to take this really quickly.
we'll get back to it, I'll fill in your part. And he should know that we're doing this live. So the other thing that Marley didn't mention, we don't talk about a lot, but contracture scars with burns as well. So you can have contracture scars, and those are really difficult to manage as well. And you have to remember that this is the normal science of scarring and the normal sequelae, which means the things that happen with scarring. So it doesn't mean that, okay, because you were left with a scar that a practitioner, you might have, maybe you had your gallbladder out, or you may have had this out or that out, or you had some kind of procedure and you were left with a scar. That doesn't mean the practitioner did anything incorrectly. It just means that your body your body, your ethnicity, your sex, or have your habits, your sun exposure. There are a lot of things that contribute to what, create a scar. So these are all things to be aware of and know that, okay, this can happen, but what can I do to make it the best or look the best? First of all, people do choose to go to a plastic surgeon because they're going to have the best scar that you can have. But even in our hands, we have had patients that have that develop keloid scarring, and there really isn't anything that, again, one is doing wrong. It is the fact that the patient's, response to the healing process is just out of our control. There's always an unknown variable in medicine that we can't control. And that's the hardest thing with keeping a relationship with a patient, good and on track. And that's why we try to talk to our patients as much as we possibly can, because having that relationship so that we can explain these things so people not get upset or but it is something that happens. I mean, we see injuries all day long, and we can't control them.
And that's why it's important to have a good communication with your surgeon, whoever it may be, and feel comfortable with them, so you can explain, the potential issues that you've had in the past, and the doctor can get a really good understanding of what he's going to have to do to make the best outcome for you.
And let me just interject something there, because when you get an injury, whether it's an accident or you cut yourself, and you go to the ER, they might put 2 stitches in to close it up. You come to Dr. Collini and he's gonna put 22 so that everything heals so incredibly beautiful. So that is the reason why if you're in the ER and you have a wound and you say, no, I wanna see a plastic surgeon.
Yeah. And he'll use a better technique of suturing to make that wound close better.
So one of the things that we were talking about when Marley was so rudely interrupted, exactly, by the
Dr. Collini.
So this is on air live. We don't have any control. So we were talking about too. I mentioned contracture scarring, like with burns. And the one thing, if you understand, if you've ever been burned or have seen someone that's really badly burned, that the skin can pucker and pull. And so one of the things that we try to do when we do scar revisions or when we're trying to help scar look better, the main thing that we try to do, we should back up. We should back up. This is where I need my laptop just to keep me in chronological order. So we're going to get back to that because that's the last thing that you want to do. Let's start with the first easiest things in case people have Christmas shopping to do. So first of all, the thing that you can do the best is you're not going to do anything to that incision if you've got or a cut or whatever for the first 2 weeks. It is healing. It's in that stage. You don't want to massage it. You want to make sure you have your antibiotic ointment on it or whatever. We happen to give patients a cream called Sickle Fate. We love Sickle Fate. You can buy it through us. You can get it online, but we like it.
And another thing doctor will do from time to time, so you're not tempted to, is he tapes right over your incision to keep it protected, keep it dry, keep it away from your fingers. Exactly.
Yeah, we don't want to pick at scars, pick at scabs. The other thing is people think that when they get a scab, that's the best thing to do. You really don't want that incision or that wound to get scabby and hard. You want to keep it moist. So a triple antibiotic ointment on it, Sickle Fate, Aquaphor. A lot of these products will keep that moist. The moisture that you can keep that wound, the better it's going to heal. So you want to keep it moist. You don't want that hard scab to form, and then you think you're going to peel it off, because that's like big number one no-no. So those are simple things that you can do for yourself. Obviously, taking vitamin C is a great thing that you can ingest orally to help yourself with healing.
And protein.
Protein, great. Staying out of the sun, that's a biggie. When you're trying to heal, you need to keep open wound without sun exposure, because that's going to discolor it, if nothing else. Even if it stays flat and small, you'll have a discoloration.
Even when it's healed and it's a scar, like you said, that scar maturation process can be going on for up to 2 years. I mean, not that you're going to not ever go in the sun for that time, but definitely using a good sunscreen, like you should be using anyways, because that scar can get hyperpigmented and that would stay dark.
And they'll stay dark, and it really is a problem going forward that you'll always see that mark. I can tell you, I have right now, I get a burn every holiday. I got a burn on my arm. So from Thanksgiving I put my hands in the oven to get the turkey, and you can see where the rack hit me right in the arm. So every year I get a burn somehow on my arm. So any different coloration, and I'm so terrible because I know what I should be doing, and you know, I'm trying to put that on at night, line up before my sickle fade and everything else that can do that. But that's just really a discoloration. It didn't blister, so I didn't have a 2nd-degree burn, 3rd-degree burn, so that's a good thing. Other than the discoloration, it should heal itself pretty well. However, getting sun exposure would keep that mark dark indefinitely. So I would have that slash across my arm indefinitely. So something to think about when you do those little things. Some of us don't care. Some of us wear clothes, cover it up. Doesn't matter. But let's just say you have a child or you yourself have some injury in the face. That's usually when people really come to us. People really don't care so much, maybe on their legs, their arms, maybe they do, but general rule of thumb, it's the face. And after, what our policy is, after that first 2 weeks of, you know, antibiotic ointment and healing ointment, all those different things, that's at the point after 2 weeks when we can start, when does Dr. Cleany use the scar cream usually?
Typically 2 to 3 weeks.
That's right, about 2 to 3 weeks.
And then we start on our scar cream products, scar products.
Right.
Yeah, which we have.
So
Really
there are a lot of scar guard type cream scar things that you can get over the counter. I have to say we've had a lot of them here and we've used them. And honestly, and I test my own scars and your own healing. I mean, we try to do our own internal, what products do we really like and what's the best. But actually, Cleany MD, we have our latest scar cream, and I have to tell you, especially because all of you know now, I had a facelift 2.5 months ago. I'm wearing my hair straight pulled back. Incisions were using the scar cream, and they're healing beautifully. So, I mean, that's one of the greatest things. If you're very proactive when you first get a wound or, you know, dress your incision site, and you can really get a great outcome. So those silicone products are really great, and ours has a sunscreen in it, so it's wonderful. You don't have to do multiple products and steps and everything.
And that can be used for 3 to 6 months, we
Right.
say. Even, I mean, it can even be used longer, but we say at least that long. And then at that point too, once you're about 3 to 4 weeks out from that incision, injury, whatever, massaging the scar too helps to flatten it out.
And that's a good thing. It should be at least 3 to 4 weeks later. Don't massage it prior to that. You could open it up. Remember, it takes 6 weeks just for an incision site to be completely gelled together before it's not going to open up. It can open up if there's an underlying infection or something like that, but you have to be aware of that. So don't massage it too soon. Wait for your doctor or clinician. Again, if you don't have one and you're just doing something from an injury, wait 3 to 4 weeks before you massage, and do it gently. And when you're going to massage it, you're going to massage it with a scar cream.
Right, so exactly, those two go together. When it's time to switch to the scar cream, then you can kind of start introducing massage very gently.
One of the things that I really love about our Cleany MD is that it's more of a lotion rather than a sticky, tacky. A lot of the scar creams are very sticky, tacky, and especially if you've got it in your face around your hair will get stuck to it and everything. And ours is wonderful, goes on just like a lotion. And honestly, I liked it so well. I put it on the rest of my face before makeup because it acts like a primer. So that's a little super secret chin thing and sunscreen and everything. So I got 4 uses out of one product. I really, really love that product. I mean, I'm prejudiced, but it really is a great product. But those are the simple things that we do in order to get the best looking scar that you can possibly have. So now, I'm going to let any of you chime in to talk about, or I can reiterate what we do. The first step that we do, if we're going to go into a surgical intervention on improving a scar, and you're not going to, I have seen patients come in and they have a small white line on their face and they want it to look better. So I've recommended them, I guess there are different opinions all the time, in not getting it removed. I don't think you're going to get that much improvement. You're going to go through a lot of hardship getting that to look better. And the only reason that you would take a scar that's very noticeable, first, if it's wide, if it's really noticeable. I mean, let's face it, we all notice our own scars, but being realistic about it, because if you cut the skin again, you're going to go through the same 2-year healing process. So you really want to be careful about when to do a scar revision. And in my opinion, I think that the time to do a scar revision surgically is when you're seeing some puckering of the skin. Because puckering of the skin, the problem is you can't ever get the tissue to look normal if there's puckering of the skin. So if there's a little buckling, or you notice that your skin's scar, I notice this with a lot of people that have thyroid scars, from thyroid surgery, their skin has scarred down, and then scarring down means that it attached itself to that next level, and when you move, it doesn't move right, and that's when it's really obvious that it's a scar. It's not so much the discoloration, it's that the skin isn't moving with the rest of it. It's not soft, right?
And sometimes when that happens, it's painful too.
Yes, it can be
Yes.
painful
So
when it's
that's
attached.
surgical
And that's another thing
revision.
that happens because of healing that really has nothing to do with a clinician or whatever. It's just something, you get scar tissue, and scar tissue can be a problem.
Yeah.
So one of the things that a plastic surgeon does with the first attempt at a scar revision is called a Z-plasty. And that is a very specific technique that I tell patients, I try to prepare them that you're going to feel like Frankenstein before you feel beautiful. And what will happen is maybe you took this straight scar that had a pucker in it, and then all of a sudden, not only is it a little bit longer, because if you cut it out, you're not cutting it at its ends, you're extending the length. And it looks like a Z or a zipper. So you have this like lightning bolt type of scar on your face or wherever you're getting the scar revision, and you wonder, what the heck, I look like Frankenstein. But the reason that you're doing this, and the reason that a plastic surgeon would do this, is again, remember, we want movement of the tissue. And when you have this zipper kind of situation going, it makes the tissue move. And for anybody that's a seamstress out there, you can tell I was at one time, and surgeons are seamstresses, really. I mean, they're sewing it up. But if you've ever cut a fabric or sewn on what's called the bias, that's where the fabric is very stretchy or very, and if you actually sewed a straight line, it would pucker all the fabric. So this is the same kind of principle. It's like cutting the fabric or cutting the skin on the bias and being able to repair it so that the tissue can move. So not that you're not going to see that mark, but within that 2-year time frame, it will heal so well you really won't notice that zipper, and the tissue will move. Again, reducing the appearance of a scar. So that's really a complicated explanation of why we do surgical scar revisions.
And that Z-plasty is also it's going to improve the structure to hold together better.
Yeah.
That skin.
Right.
Yeah, it's also a Z-plasty or W-plasty. Like if you hear that.
Yeah, you can
term.
have a W or a Z, different ways, but it's again
Same
a way
thing,
in which to attach the edges of the skin, keep them together, and keep them being able to move. And they should heal flat. You might have the mark. You will have that mark for a while. And again, we would prepare you for scar creams and all the other things.
And in that event, I've seen doctor in the OR who'll use a different suture technique for a Z-plasty versus a regular closure of something, just because it's going to improve that quality.
And different suture too. I mean, we would use different sutures sometimes that would improve. And some of those sutures are very expensive. I mean, I can honestly tell you one time I must have had a heart attack because I'm looking at the cost of everything we do, and I remember that he was sewing up, and we were just looking at our suture inventory, and for babies, which I don't blame him, I would want him to do this, but the actual suture that we used on these babies was $1,000 for a little packet. And I was kind of like floored, my jaw dropped, because the insurance doesn't cover that. They cover the repair. So the repair, we might have been reimbursed $350, and we were spending $1,000 for the suture so that the baby would have the best outcome. And I said, can we find like a happy medium, with that, because it's unfortunately it's the cost of doing healthcare, and It is expensive, and so that's gonna lead me into whether insurance covers anything. So does anybody else have anything to add? Cause I know this is so technical, but I don't wanna we could spend hours
Well,
upon.
one thing you had mentioned, if you come across a scar and it's like a white line, we have tattooing upstairs with Lauren Carey that she can actually put pigment back into that hypopigmented scar. Laser can take the red out, but it can't put pigment back in, so I think that's another
Right.
alternative.
So we didn't touch on that, we hit the surgical intervention here, but Karen has brought up, before we get back to insurance, we'll do that the last thing, because that's another whole issue. But, so let's just say you've gone for surgical intervention, and even then, maybe the scar is still not as good as you would like, so then what can we do? We do have, there are treatments, we have dermabrasion, we have surgical and a spa dermabrasion, so we have lighter version, microneedling, we have, exactly, and so we have laser, and we have chemical peels and different things. So I'm gonna throw this over to Karen and Lori and talk about addressing lasers with scarring. So that's that's another step of improving the appearance of scars. And if you go on Derek's laser page, you can see what his Instagram, what is it called, his laser page?
Laser Aesthetics by Derek.
Laser Aesthetics by Derek. They are hooked up with the Age of Innocence and the Renaissance Center pages, but he has his own list there. But you can see many of the scar improvements that he's got with laser, which is amazing. And but I'm going to turn that over to the two of you and let you chime in with anything that you know.
You jump right in here, but it's kind of ironic that laser creates its own second scar. It takes away the old dead stuff and recreates a new scar that's flatter and more aesthetically appealing. You will never get rid of the scar, and I think some people do have that misconception. Well, I won't go to a surgeon because he'll give me another scar, but I'll get a laser removal and that'll take the scar away. Well, it does not. Time heals it. Certainly all the good care we talked about heal it. And lasers are a great way to make sure that it is flat, make sure that it's not red. A fun fact that I remember studying about hypertrophic are more noticeable in younger population because it seems to be an imbalance of the collagen production. So somebody around age 30 is more likely to get a hypertrophic scar. And that's, laser can work very well on that, and so can microneedling, soften the scars.
Yeah, it will definitely improve the appearance.
Yeah, and I think, if a scar is bothering you aesthetically, if it's painful, or if it is disfiguring to some extent, we can also put in fillers next to a scar to fill in the deficit.
Acne scarring.
And acne scarring, the ice pick scarring.
Depression scars can be filled with.
We have like a host of A, B, and C's that we can do to make your scar look and feel better.
Right.
So
laser's
one of the good things about laser too is especially if you're trying to accelerate the appearance. So the initial, you've got 3 to 6 months where where every scar is going to be red like this. If I'm getting married, I can't have this scar on my arm because my arm is the most important body part I have at that moment.
You can even lighten that.
Right,
redness.
you can take the red out with the lasers, yes.
Yeah.
So, but again, it takes time for healing. This doesn't happen overnight, so you have to plan for this. Okay, I'm getting married next week and you're deciding to have a laser. No. So that's where our expertise will help guide you. Give us all your parameters of what you're trying to achieve and in what time frame, and we can tell you whether it's realistic or not. Because skin healing is a long process. It doesn't just happen like that. It's not like going to the beauty parlor, putting your makeup on, or getting your hair done and looking like $1 million.
And everybody heals differently.
Yes, exactly.
So.
Exactly. And I think that they're always our challenge because everybody judges everybody. I mean, if you go to a general surgeon, you could have done the greatest gallbladder surgery in the world, but patients only look at the scar. Oh, he left me with the worst scar. And it really isn't it. It's just that skin heals differently for all people. And, we go through a lot of effort to make it the best scar that you can have. I don't know if anybody else wants to chime in about anything else about what we're doing with scarring.
I could just throw in there that during, say, some of the procedures that we do in the OR, if it's definitely a cosmetic procedure, we will add PRP, which is platelet-rich plasma. So we actually take your blood and we harvest the platelet-rich plasma from it, and we'll put that over the scar. So that contains a lot of growth factors that are going to actually aid in that healing process and speed it up a little bit quicker, which is, I think it's
Amazing,
Yeah.
because that's exactly what we did with my lift as well. So I know that those stem cells and those growth factors really were amazing. Unfortunately, this is going to be a perfect lead into insurance, on whether insurance does anything with this. Unfortunately, insurance will get involved in a couple of different things. If you have some hypertrophic scarring and we can excise and do a surgical scar revision, many insurances will cover that. If we have to do, if somebody has really some bad keloids, there is a combination of not only are we excising it, but they actually have to have some radiation to the, and steroids for to prevent that tissue from growing again, because just because you cut it out doesn't mean it won't come back. So those things can be covered by insurance. When you're getting into lasers, you're getting into chemical peels, you're getting into more aesthetics, any of the creams, insurance is not gonna cover it. So you have to understand that that's out of pocket. If you were having a surgery and you wanted to have PRP, you were getting an insurance procedure and you wanted the PRP to be used, you'd have to pay for that out of pocket. The insurance companies are not paying for those added elements to your surgical procedure, unfortunately. So as I tell patients, insurance, if it's a medical issue, the insurance is, well, sometimes that's even sketchy anymore, they cover it. But definitely to make you prettier, they're not gonna cover it. You have to consider it a cosmetic, in nature. But doing those first simple things right away when something's brand new is the best thing that anybody can do to help
The initial
yourself.
treatments of it when you get it done, yeah.
With insurance now, if it's painful, that could be medically necessary, that
Yes,
surgical
yes,
scar,
yes,
right?
yes.
But now what if it's just the appearance is,
So yeah, if you don't like the appearance, it depends. And we are very good at trying to get pre-authorization, trying to get things approved. We go through as much as we possibly can for our patients, but if it doesn't have certain elements about being contracture or hypertrophic, these things, the insurance isn't gonna cover it. So you have to just be aware of that. We do the best we can for you, but for a lot of things that when patients want that next step, that next element, they're not gonna cover it. So that's the downer part of this. Roundtable.
I wonder if we could make it like psychologically, because it is. I mean, if you
It's
have a scar
psychological.
on your face and you're a teenager, mentally and psychologically, you'd be affected, get depressive
Right.
disorders, so, that should open a door for some insurance
And
companies
I
to do that.
even know, working in the medical field previously, also that we actually had patients call their insurance companies and fight with them to
Well,
get things covered.
I always say
Yeah.
the squeaky wheel gets the
Yep.
oil, so.
And they would
if-
cover it then
No, no,
because.
this actually crosses anything out of scar vision. If you're having an issue that you
Right.
think should be medically, taken care of by your insurance company, then, you keep squeaking, because
Right.
we as practitioners can't. The
Right.
insurance companies really don't wanna hear from us, they're said, done, close the book.
Right.
But if a subscriber or a patient
Which is
is
their
going to
member
call,
that's calling.
that's right, that's calling, squeaky wheel gets the oil,
Yes.
so you can fight it. And especially for those patients that we do get pre-authorization and then they're denied afterward, which can happen. In that case, the squeaky wheel really
Yes.
has an advantage and you should squeak.
Right.
That's just the craziest sentence to me, that we got pre-authorization and then they're denying it, and I just still can't believe that happens.
It happens on a daily
Because
basis.
what's the point? Why did we get the pre-authorization?
So anybody that's really listening to this roundtable, if you have any legislative power whatsoever in which to try to see into our problems, I do not understand how, first of all, in my opinion, there should be a certain list of codes and situations that should not need pre-authorization.
Right.
Period. They shouldn't. We all know they're
Right.
medically necessary, they're whatever. If they're not in your insurance contract,
Yeah.
fine, that's one issue. But for us to get medical pre-authorization seems to be
Mhm.
an oxymoron. And then to say in the fine print, in the insurance companies, this is not a guarantee of payment. I don't understand, why are we getting it pre-authorized?
Yeah,
We're trying to
that work.
pre-authorize whether this is a medical condition that you cover. If it's covered in that insurance contract, we did this, and then you wanna deny it. This is another roundtable for another discussion, and how to fight insurance companies, and how to make them start like reducing the amount of ridiculous work that we have to do as practitioners, that reduce the time that we have, that we can give access to care. I think that that is, they didn't ask my opinion, but I do work in behalf in trying to get that information out. I write lots of letters, make lots of phone calls to anybody that's willing to listen, and we have gotten a few things. Again, that's gonna be another conversation, insurance and fighting it on another
Next
roundtable.
roundtable, medical legal issues.
So on that note, I really wanna end this, because we did a lot of medical stuff and didn't do fun stuff. So, we're gonna do a real quick personal thing on what we're doing for the holidays, and then, personally, and then what we can do for you cosmetically for the holidays.
Yeah, I'll start out. So I'll be enjoying my Christmas and New Year's at home, which is perfect, and something that we definitely want to look at towards the winter, procedure-wise, is I mentioned to Susan earlier, is sclerotherapy. So for those that have spider veins or the varicose veins, winter is a good time to get those taken care of, and we do sclerotherapy here. So come in, get it done. If they bother you, we'll help you out and get them taken care of.
Well, that leads me to tell you what the next roundtable is in January. We're going to list all of those different things people should be doing in the dead of winter,
Yes.
so that you know how to prepare yourself. So
Yes.
that's our January roundtable, so that's
Yeah.
perfect. Things that you need to do it, that takes some time for
Right.
healing, and we'll be doing that. So that's our roundtable in January,
Alright.
so that's perfect.
Preview.
And
And
so,
chemical peels to that, because if you want a deep chemical peel, that's the time to have it, not when you're fighting with, I have to go out in the sun, or
Same thing.
there's some downtime in February, January, February, great time for a good chemical peel.
that's right. And then, so what are you gonna be doing personally, Lori?
I'm probably gonna be at my mom's for Christmas Eve and my brother's for Christmas Day.
Perfect,
Yes.
perfect.
Yes, and I think, the winter, like around this time, is the best time also to get any laser treatments, because you do have to stay out of the sun. And some of them require like 3 treatments, and they have to be like 4 to 6 weeks apart.
So you have some
So
time.
So you have some
It's
time to get
best.
them done.
Yeah.
So I made
You know.
sure that Derek was gonna be here at the next one, so he can go over
Oh,
with
yes.
you all those laser things that
Yeah.
you do need to schedule
Right.
all that in the long run. So Karen, what are you gonna do for the holidays?
Well, I always host the holidays, so I'm in the process of taking down Thanksgiving, which is all piled on my kitchen table right now. Go out and cut down the tree, not necessarily
Oh,
cut it down.
mountain
Oh,
woman,
wow.
go down and cut it down.
I
It's
did
really
that
awesome.
the first time, I sawed it and drug it.
Wow.
Put it up.
Yeah,
Karen's in great shape, she's our
She
activist.
is.
and then decorate it, and have family. My grandkids are all coming in from West Virginia and from Allentown, so I'm looking forward to Santa Claus having some stuff on
That's
the tree.
awesome.
Awesome, awesome.
Yeah.
Marley, what's up?
I don't know. I just got through hosting
Newly
my
engaged.
first Thanksgiving,
Oh.
and that was successful. So I didn't move on yet to what my plans for Christmas are. I got through that
It is a challenge.
successfully.
Well, one of the things that all of us are gonna be doing, we're gonna be doing our office Christmas party this Saturday, so we get to start, we're actually a week behind, cause Thanksgiving was so late, so we're missing somebody said I don't know how you actually miss a week of before Christmas.
I know,
Because it's
right?
at the same time, but
Yeah.
depends on where Thanksgiving falls and to whether you have that extra weekend or
Yeah.
whatever.
Okay.
But so we have our office party.
Yeah.
Yeah.
First.
It's officially the season.
It's December 1st, and I have to give a shout out. Today is my younger brother Cliff's 60th birthday.
Oh.
Today,
Wow.
so happy birthday,
Birthday.
Cliff. He doesn't watch, but he's a mountain man, really a mountain man. He's got the Grizzly Adams beard and everything, so,
Protecting the skin.
aesthetics, okay, well, what are we doing here? But on that note, I guess we're going to sign off to everybody. Wish everybody a really Merry Christmas, and we will see you the first Wednesday of January, and we will be talking about all those great services that you need some time to heal and break for the winter. So see you in January. Bye, everybody.